Opioid use in our youth. This module is sponsored by the University of Texas Health Science Center, Center for Health Analytics, and our Young Heroes program. Our goal in this module is to help you understand the current trends and impact of the opioid crisis in our youth, how it happens, and what to look for. By the end of this module, you will be able to recognize the risk factors, signs and symptoms of opioid use disorder, and how to create a safe space to educate our youth on opioid misuse through the development of prevention programs, and we will provide you with resources for further information. Nick is an average teenager from a small town of no more than 20,000 people. He was an athlete with moderate to good grades. Within several months, Nick had broken a thumb during a football game, which needed surgery, had a tooth infection that required a tooth to be pulled, and had a motorcycle accident resulting in road rash over 80% of his body. In each instance, the doctors prescribed Nick hydrocodone. Nick is my stepson. I knew the dangers of opioids. In each instance, I gave Nick 1 to 2 pills, and then ibuprofen after that. I thought I was making the right choices by limiting his doses. But in just 6 months, Nick's behavior had changed. After his motorcycle accident, despite feeling better, he became aggressive. I would only allow 1 or 2 pills a day for the first couple of days. After that, he began begging for his medications, searching my room and the cupboards. We didn't know that friends helped Nick find pills. Street pills eventually were his go-to, and then over time, heroin. Thankfully, Nick's story is a story of survival. After 8 years of struggle, he got the help he needed and is now working hard to break his cycle of his substance use disorder. But unfortunately, this isn't always the case. Too often, we are losing the battle against opioid use in our youth. Unfortunately, we know that it begins the same way as Nick's story, with a prescription. In 2017, physicians wrote over 3 million prescriptions for opioids for youth ages 0 to 21. In 2019, despite new regulations, the number of opioids written for the same age group rose to over 4 million. The overdose death rate increased from 4,000 in 2017 to 4,777 in 2019. 73% of these deaths were from prescription opioids. The definition of drug misuse is taking prescription opioids not as directed, using other person's prescription, or using their prescriptions for reasons other than indicated. The most common opioid reportedly misused was hydrocodone. In 2016, 3.5% of 12 to 17-year-olds in the United States reported misuse of opioid pain relievers in the past year. Children of this age group say that they started misusing opioids first because of physical pain, but continued because they were easy to get. They were pressured into it by friends, or they were simply curious. As students age, the misuse of prescription opioids nearly doubles. It's important to understand the misperceptions that are occurring and why they are occurring. 2/3 of individuals aged 12 to 24 stated that they used prescription drugs because they believed they were safe. Most kids said they thought prescription drugs were safe because prescriptions were advertised on television. They saw family members use them, or had been given the pills by friends. In addition, 66% stated their parents gave them the pills despite not being prescribed to the child. Children and young adults are especially vulnerable to the effects of opioid use. Their brains are newly developing, creating pathways and neurological connections that are not yet fully established. Misuse of any drug can have long-lasting effects on the developing brain and may interfere with family, positive peer relationships, and school performance. Adults who develop a substance use disorder state that they started drug use in adolescence or young adulthood. Identification and early intervention is imperative. Substance use disorder is a progressive disease with addiction at the most extreme end of the disorder. People do not automatically move along the spectrum. When a person has a substance use disorder, their brain structure changes. It then becomes necessary to use the drug to feel more normal and to avoid withdrawal symptoms. On the other hand, someone may use substances casually for years and never progress to harmful use. People can be at different points on the spectrum for different drug choices and at different times. People may start using opioids for one reason and continue using them for another. They may begin to use opioids to help them deal with pain or difficult emotions or experiences and continue using opioids to prevent withdrawal. Keep in mind that addiction is not a moral failing. The parents and caregivers did not fail or cause the behavior. It's a disease. Although addiction cannot be cured, a person can learn to control their addiction and manage it over time. Early intervention can help move a substance use disorder into recovery. It is essential to understand the risk factors and that developing a prevention program can help.